Okay, so it's AEP, and that is the time of the year when you can make changes to your Medicare plan option. And I mean so much to the point that you got Joe Namath, you got Bill Shatner, and you even got George Foreman on television telling you to do it. But what can you actually change during AEP? Because not all changes are created equal and even available during the AEP period. So today we are going to talk about the 5 things you can actually do during the Medicare annual election period. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them during AEP or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. All right, so here we go. AEP, it's that magical time of the year when Costco has Halloween, Thanksgiving, and Christmas decorations all put out on the exact same shelves. But also it's when folks on Medicare can make changes to their plans. It runs from October 15th through December 7th, and whatever changes a person decides to make, if they make them, well, those are going to go into effect next year, that is January 1st. Additionally, during the AEP period, you can make as many changes as you'd like to your Medicare options, but only the last one that someone chooses will go into effect. And trust me, that happens all the time. But what are those changes you can make? Here's 5 of them. First and foremost, one of the biggest things that someone could do during the annual election period is to choose and enroll into an additional Medicare plan option, primarily Medicare Advantage plans, but also sometimes called Medicare Part C or even sometimes called MAPD. What these are private health insurance plans similar to a health plan that someone maybe had during they're under 65 years old or at their work or maybe through an employer. And they have set copays, set co-insurances, and set limits to how much a Medicare beneficiary can pay for their health care during the year. Furthermore, the vast majority of these types of plans are going to be HMO style plans, which does mean that they get managed. And some people like that, while others not so much. But really, unless somebody has a special enrollment period or an SEP throughout the year, AEP will be the only time of the year when that person who has original Medicare, that is Medicare Part A and Part B, will be able to opt in to a Medicare Advantage plan. Lastly, if someone does choose an MAPD during AEP, it will not start until January 1st. Next up, and in sort of the same vein as the Medicare Advantage, is that a person who chooses to enroll in a Medicare Part D plan can do so during the AEP period. Now, this is a little bit different because the requirements are different, but what is the same as the MAPD is that any plan that is enrolled into during the roughly 3 months of AEP, it's not going to start until the first of the following year. Some of the main differences is that a Part D plan only covers Medicare prescriptions. That is, medications that are usually picked up at the pharmacy. Additionally, for Medicare Advantage plans, somebody would need to have both Medicare Part A and Part B, so both parts of original Medicare. But for a Part D plan, a person only needs Part A or Part B. Of course, they can have both A and B, but they don't have to have both. They can have one or the other. One final, not so minor aspect of Medicare Part D is that because it does have a monthly premium, some folks are hesitant to enroll in the Part D plan, but it is important to understand that there is a late enrollment penalty applicable to anyone who could be enrolled in Medicare Part D but doesn't. So, there's that. On the inverse side of the first thing we talked about is that someone can also decide to leave their Medicare Advantage plan. In fact, it can be dropped during the AEP period, and they would be able to go back to original Medicare. Of course, the caveat to this is if someone has an MAPD plan, it means that they will be losing their Medicare Part D prescription drug coverage that comes along with that MAPD. This would mean that after dropping the MAPD, if someone does decide just to go back to original Medicare, they would also need to enroll in a Medicare Part D plan. So they will still have the coverage for those drugs and don't get, that late penalty. Another great thing that can be done during the AEP period, and really is the reason for all the celebrities on TV and random phone calls and your mailbox exploding with Medicare ads, is someone can change their Medicare Advantage plan. So that means they are able to switch from one to another during that AEP period. Now, there are a lot of reasons to do this, and it's not just the plan with the best Medicare Part B reimbursement, but during the AEP period, a person can actually change their plans as many times as they like, up into and until the very end of the deadline, which is on December 7th. And whichever plan that they choose last, that plan is the plan that they're going to have starting January 1st. And last up for today, and really you probably should have been able to guess it by now, which is that during the AEP period, a Medicare beneficiary is able to drop their Medicare Part D prescription drug coverage altogether. Now, the reasons for this are few. There's not really a lot of great reasons to do this. One could be they are choosing a Medicare Advantage plan that also has their Part D included. Another could be that they are getting prescription coverage that is credible from somewhere else, like an employer or a spouse. And third is that they just don't want to pay for the Medicare Part D and never use it. But just keep in mind that that third option is a bad idea. Gone. Because there is a penalty, of course, that starts to grow. But also, if you need prescription drugs, at least here in the good old US of A, those costs are going to be pretty high and you won't get any help paying for them. Also, if you are considering this, there are a lot of programs like LIS, the Low Income Subsidy Program, that could really help to pay for some or even potentially all of those Medicare Part D costs. Far be it from me, of course, to talk you off the ledge from canceling your Part D, but, don't do it. It's usually a very bad idea. All right, so that's it for today's Michael's Medicare, and I really hope you enjoyed this video, and if you or somebody you know is trying to work through some of those tough Medicare quandaries, please feel free to reach out to us at the information down below, or leave a comment, or just like and subscribe and follow so you can get notified when our newest content comes out on the socials, on Instagram, on YouTube, because we have new, great Medicare content coming out every single week. So for Michael's Medicare, I am Michael, hoping that you have a great rest of your day, and goodbye.